My name is Sean Moran. I'm a patient of Dr. Johann Sebastian Clinician and his staff. I willingly gave Dr. Clinician my private and personal information as part of his clinical research study. However, during the time I was a patient, I was never informed that my information was going to be released to any third-party organizations, and especially not without my prior consent. This third-party organization wrongfully received my information along with the information of many other patients and utilized this information to begin calling patients for their own research study. This is a violation of my control over my own personal information. I have a right to not only know where my information is being shared and who it is being shared to, but also have a decision in the process of sharing that information or choosing to not share that information in the first place. Bastias wrote in his 2013 text, Healthcare Ethics and Medical Law, that when allowing access to this private sphere, an individual is retaining control of this right rather than waiving it. This means that just because I shared information with one doctor or research study, it does not mean I am waiving the right to control the information I have shared in the future. I did not sign a blank check for my own information. I did not sign any open consent form stating that my information could be spread to other organizations, and therefore any information sharing should have been sent to me for approval prior to ever taking place. This is a breach of my confidentiality. Confidentiality is the ethical and legal obligation to obtain my authorization as the patient prior to sharing any of my information. Just like my right to privacy, I have a right to confidentiality. I am also protected by the Health Insurance Portability and Accountability Act. This act restricts the disclosure of information without patient permission. It also lists 18 identifiers that need to be redacted or removed from any information that's going to be shared prior to the sharing of any information. This ensures that the information that is shared for a research study or any other purpose is generic and is not identified to a particular patient, i.e. me. These indicators include names, any geographical subdivision smaller than a state, dates that directly relate to the individual, such as a birth date, phone number, fax number, email address, social security numbers, medical record numbers, health plan beneficiary numbers, account numbers, certificate or license numbers, vehicle identifiers such as a license plate, device identifiers and serial numbers, web addresses or universal resource locators, internet protocol address numbers, biometric identifiers, full face images, any unique to the patient codes, numbers, characteristics such as diagnostic codes. At a minimum, it is known that my name, diagnostic code, phone number, and patient history were shared, and this is a blatant violation of the Act. Though these actions that have been taken, Dr. Clinician has denied me my right to privacy and confidentiality by sharing my personal information and diagnostic codes to another organization. His claim that this is acceptable as part of preparation for research is unfounded and inaccurate because my information should not have been used to contact me as a part of the research study if they were simply trying to prepare for the research. As soon as they start contacting patients, the research study has already begun, my information has already been shared without my consent, and the violation has already taken place. This is an unacceptable violation of my ethical and legal rights, and legal action must be taken against Dr. Clinician and his staff to ensure that patients in the future are not violated and have their rights stolen from them for confidentiality and privacy, especially when it comes to medical and personal information.